Section 1. Community Health, the Power of Knowing. Community health programs are vital. They address health challenges faced by people, and they need careful management. Monitoring and evaluation, or M&E, is key to this. M&E helps us understand what works and what doesn't. It's about collecting information, analyzing that information to make programs better. Imagine a community struggling with high rates of childhood illnesses. A health program might introduce vaccinations. M&E helps track if those vaccinations are reaching children. It tells us if the number of illnesses is decreasing. This information helps programs succeed. M&E is about accountability. It helps make sure resources are used well. It's about continuous improvement. By tracking progress, programs can adapt and become more effective. This leads to better health outcomes for everyone. In essence, M&E empowers community health programs. It gives them the information they need to make a real difference. It's about using data to drive positive change and create healthier communities. Section 2. A Promise to Mothers and Children, the Initiative. Let's picture a community facing challenges in maternal and child health. The rates of infant mortality might be high. Access to prenatal care could be limited. This is where a targeted health initiative comes in. This initiative, focused on mothers and children, has clear goals. It aims to reduce infant mortality rates. It seeks to improve access to quality prenatal care. It wants to empower mothers with health knowledge. The objectives are specific steps to reach these goals. Training local health workers is one objective. Establishing mobile clinics for remote areas is another. Creating educational programs for mothers is also crucial. This initiative, with its focus on maternal and child health, is a beacon of hope. It represents a commitment to improving the well-being of the most vulnerable. And M&E is there every step of the way, ensuring that the initiative delivers on its promise. Section 3. Building the Blueprint. Designing an M&E plan. A successful health initiative needs a roadmap. This roadmap is the M&E plan. It guides every step of the journey. It ensures that the program stays on track and achieves its goals. The first step is to revisit the goals and objectives of the initiative. What are the specific outcomes we want to see? These outcomes will be the focus of our monitoring efforts. Next, we need to identify indicators. Indicators are measurable factors that tell us if we are making progress. For example, the number of prenatal care visits or the percentage of children vaccinated. Data collection methods are then carefully selected. Will we use surveys, interviews, or medical records? The chosen methods must be appropriate for the indicators we are measuring. Finally, a timeline for data collection and analysis is established. This ensures that the M&E process is systematic and ongoing. A well-designed M&E plan is the foundation for a successful community health initiative. Section 4. Goals and Milestones. Setting the targets. Setting clear and achievable targets is essential. It allows us to measure the effectiveness of our initiative. For our maternal and child health program, we need specific, measurable, achievable, relevant, and time-bound, SMART goals. Our primary goal is to reduce the infant mortality rate by 15% within 3 years. To achieve this, we aim to increase the percentage of pregnant women attending at least 4 antenatal care visits to 80% within the same time frame. Furthermore, we plan to increase the percentage of children fully immunized with basic vaccines by age 1 to 90% within 3 years. These targets provide a clear direction for our program and allow us to track our progress effectively. By setting these ambitious yet achievable goals, we demonstrate our commitment to creating a healthier future for mothers and children in the community. Section 5. The right tools for the job-choosing data collection methods. Choosing the right data collection methods is crucial. It ensures we gather accurate and relevant information for our M&E plan. Each method has its strengths and weaknesses, so selecting those that align with our objectives is key. Surveys are valuable for gathering quantitative data. They help us understand the prevalence of certain health practices or the reach of our program. For instance, we can use surveys to determine the percentage of households using insecticide-treated bed nets to prevent malaria. Interviews, on the other hand, provide rich qualitative data. They offer insights into community perceptions, beliefs, and experiences related to maternal and child health. This information can help us tailor our interventions to better address the community's needs. Additionally, reviewing existing medical records can provide valuable baseline and follow-up data. This data can help us track changes in infant mortality rates, vaccination coverage, and other key indicators over time. Section 6, Surveys, Voices from the Community. Surveys are powerful tools in community health initiatives. They give a voice to the community. They help us understand their needs, perceptions, and experiences. In our maternal and child health program, we can use surveys to gather quantitative data from mothers. Questions can focus on key aspects. These include antenatal care attendance, breastfeeding practices, and knowledge of danger signs during pregnancy. To ensure representativeness, we'll use a randomized sampling method. This means every mother in the target population has an equal chance of being selected. This helps reduce bias and increase the reliability of our findings. By analyzing the survey data, we can identify trends and patterns in maternal and child health practices. This information is crucial for tailoring interventions and improving program effectiveness. Section 7, Beyond Numbers, Qualitative Data Collection. While numbers are important, they don't tell the whole story. Qualitative data collection methods provide depth and context. They help us understand the why behind the numbers. Focus group discussions are a valuable qualitative method. They bring together small groups of community members to discuss specific topics. In our initiative, we can conduct focus group discussions with mothers. These discussions can explore their experiences with antenatal care services. They can also uncover barriers to accessing these services. This information helps us tailor our interventions to be more effective. Another method is in-depth interviews. These are one-on-one conversations with key informants. These could be healthcare workers, traditional birth attendants, or community leaders. Their insights provide valuable perspectives on the challenges and successes of our program. Collecting data is only the first step. We need to analyze it to extract meaningful information. Data analysis helps us understand what the data means and how we can use it to improve our program. For quantitative data like survey responses, we can use statistical software. This software helps us calculate frequencies, percentages, and averages. For example, we can determine the percentage of mothers who exclusively breastfeed their babies up to 6 months. Qualitative data from focus groups and interviews require a different approach. We need to transcribe the recordings and analyze the text. This involves identifying recurring themes, patterns, and insights. The findings from both quantitative and qualitative data analysis are combined to provide a comprehensive picture. This helps us understand the effectiveness of our program and identify areas for improvement. Section 9. Turning data into action, using findings for improvement. Data analysis is meaningless if it doesn't lead to action. The findings from our M&E activities should guide program improvement. This is where data translates into real-world impact. Let's say our survey reveals that a significant portion of mothers are not attending antenatal care visits. Further analysis of focus group discussions highlights transportation as a major barrier. This finding is actionable. We can address this barrier by exploring options like providing transportation vouchers or establishing mobile clinics. This is just one example of how M&E findings can lead to program adjustments that better serve the community. Regular review of M&E data allows for ongoing program adaptation. This iterative process ensures that the program remains relevant, responsive, and effective in achieving its goals. Section 10. The ripple effect, M&E's impact on community health. The impact of a well-executed M&E plan extends beyond immediate program improvements. It creates a ripple effect influencing the broader community health landscape. Firstly, M&E promotes transparency and accountability. When stakeholders see that a program is being monitored and evaluated, it builds trust and confidence. This can lead to increased community participation and support. Secondly, M&E fosters a culture of learning and improvement. By regularly analyzing data and making adjustments, programs become more efficient and effective in addressing health challenges. Moreover, the findings from M&E activities can inform policy decisions. Evidence-based data can advocate for increased resource allocation or policy changes that support community health priorities. In essence, M&E is not just about data. It's about making a tangible difference in the lives of individuals and communities. Section 11. Sustainability, the key to lasting change. Sustainability is crucial for the long-term success of any community health initiative. It's not enough to achieve short-term gains. We need to ensure that positive changes are sustained over time. M&E plays a vital role in sustainability. By tracking program outcomes and identifying factors that contribute to success, we can develop strategies to maintain those gains. One aspect of sustainability is building local capacity. This involves training community health workers and equipping them with the skills and resources to continue program activities. Another aspect is advocating for continued funding and support. By demonstrating the program's effectiveness through M&E data, we can make a strong case for ongoing investment in community health. Section 12 M&E, a catalyst for healthier communities. In conclusion, monitoring and evaluation is not just a technical exercise, it's a transformative force in community health. It empowers us to understand what works, make informed decisions, and drive meaningful change. From setting clear goals to selecting appropriate data collection methods and using findings for program improvement, each step in the M&E process contributes to better health outcomes. By embracing M&E as an integral part of community health initiatives, we can create a brighter and healthier future for all. It's about harnessing the power of data to transform lives and build more resilient communities.